So in the United States, the American Academy of Pediatrics, which is our medical society that sort of sets guidelines for checkups and protocols for when kids are sick with different things, recommends that babies are seen after hospital, so within a couple days of going home from birth, then somewhere between 2 and 4 weeks. And that check tends to be a lot of just making sure that everything is going okay, the baby's gaining weight and eating well. Then we see babies at 2 months, 4 months, 6 months, 9 months, and 12 months. Those are all the recommended well-child visits with your doctor. They tend to be, focused sort of on weight gain and on development and on how mom is doing and how the family's adapting to the new baby. And then we do vaccines at most of those visits. The later visits, the 9 and 12 months, may have some blood work, depending on where you are and certain risk factors.